You hear me okay?
Perfectly.
Awesome.
Everybody, welcome to the Environmental Justice Legislative Team briefing on air quality and community health. We're starting a little bit late, so I'm going to jump right in. My name is Tamara Tolles-O'Laughlin, and I'm the Executive Director of the Maryland Environmental Health Network. Details on how to reach us are here on this slide. The network is a co-chair of the Environmental Justice Legislative Team with Clean Water Action. Our membership is open, and so if you are looking for a place to work on environmentally focused policy with a really specific bent on justice work, we work together to magnify community voices through the legislative process to address inequities in Maryland, and are thinking about the long-term importance of developing a learning table for inclusive and equitable policy development. Our founding members include Blue Water Baltimore, the Beloved Community Church in Accokeek, Maryland, Chesapeake Physicians for Social Responsibility, Clean Water Action, Chispa, Maryland, Interfaith Partners for the Chesapeake, the Maryland chapter of the Sierra Club, and the League of Conservation Voters, among others. Our mission at the Maryland Environmental Health Network is simple: to promote the elimination of environmental threats to human health. And that involves us taking a deep dive on what we can do as advocates and as specialists to level the playing field for and with vulnerable populations. So what we'll cover today, we have a jam-packed program with some really smart folks who are going to help us think together about what the public health lens should be on air pollution. As we all know, the World Health Organization has given us our marching orders in thinking about how much of air pollution determines people's capacity to thrive and survive. So we'll talk a little bit about that in our discussion, and then we'll end with emerging proposals and some bills that are on the horizon to deal with just this issue. We'll make space for questions and answers, and then end with closing announcements. Our partners today are several, so I will introduce them briefly. Ava Richardson, the Baltimore Coalition Coordinator at Energy Justice Network. Ava has worked on health disparity issues for over 10 years, leading public health programs, initiatives, and grassroots and organizing efforts as a researcher and a program manager. Her career has been focused on eliminating racial, economic, and geographic and health disparities nationwide through community-led change programs. She's a Maryland native with roots in Baltimore, and she's working on environmental justice in a city that she loves. She's currently a doctoral student at Hopkins University and holds a bachelor in biology and a master's in public health from Frostburg State and Morgan State Universities, respectively. And I'll tell you, that kind of resume says she's Maryland, for real. I just want everyone to know that being able to work in Morgan State and Frostburg means you are right in the heart of some places where natural gas infrastructure and some of the stuff we hold dear is really permeating the conversation around the work that we're doing. So welcome, Ava. Next slide. Our other partner today is Mike Ewald, the founder and executive director of the Energy Justice Network, which is a national support network for grassroots community groups fighting dirty energy and waste industry facilities, including coal power, ethanol, natural gas, landfills, and incinerators of every sort. You'll hear from him today as he talks about his long-term background, his interest and capacity for closing down some of the worst offenders in Baltimore, which drive pollution in the state. Our other partner, who you may hear in the background, is Kathy Phillips. She's a coastkeeper and a real proponent of community health, equity, and access. She has been a strong proponent in our public dialogue around what communities need to protect their health as we make investments in what businesses we support, what infrastructure we develop, and what that does for the health of communities. Thank you to each of our partners for joining us today. I'm going to briefly talk about generally why the environmental health lens is important for focusing on issues of air quality. We can very easily just look at this industry by industry and think about what they are doing, but the better part of valor in this instance is for us to think about the human health impacts across these industries so that we can really get to the heart of why we invest in things that hurt people. Why do environmental health folks care about this stuff? Because air pollution, hazardous waste, water, sanitation, chemicals, radiation, community noise, occupational risks, and the built environment, as well as climate change, are things that we have to think about because it impacts our community members. So environmental health, we interrogate trends at the level of population. So we don't just pick a specific grouping of people, but we're thinking about population level impacts, because what occurs within us is very easily and very clearly connected to what's going on around us. Environmental health examines the reasons that health is easier or harder to achieve for specific groups, and really investigates the gaps in ability to survive and thrive in your society and culture. What we're going for here is to lower the likelihood of untimely death and sickness while helping human beings achieve the ability to make positive and meaningful lives of their own making. So it is a matter of self-determination that is premised on the idea that if the deck is stacked against you, if your air and water are poisoned, then you don't have the ability to reach any set of goals that you would set for yourself, because the very playing field itself is not the same for you as for others. So why do we care about environmental health and air quality? Because stress has known impacts on the immune response, which means you're more likely to become sick or to succumb to an illness that you might have otherwise recovered from if you are dynamically also being challenged by stresses. So psychosocial stress and air pollution, while still being a burgeoning area of research, are a place where we can clearly connect communities that are facing unwanted industries and their likelihood of succumbing to really significant forms of health threats as a result of having a weakened immune system in response to air quality and air pollution. It causes respiratory disease, makes it more likely that people will be faced with it, and then exasperates whatever conditions people have on day one. What we promote and what we devalue in our state impacts the health of generations of Marylanders. So water quality and air quality, which we'll discuss today, just having information on that sort of thing can be really helpful in making a community resilient. We care about inclusion, and our guests will speak more about that today, but simply our premise is that inclusion improves the quality of decision making and is a benefit to every stakeholder. So not just the community that's involved, but the state level agency that gives a permit or does not give a permit, to the quality of the health department that is able to better get a sense of where and why people are feeling harms. And so inclusion is not a favor that happens for communities who are invited into a conversation. It's a benefit to all stakeholders interested in a process that works for everybody. The threats we hear from community members that we serve in our network are that they're concerned about proximity to industry and industrial activity. They're concerned about air, light, and water pollution impacts on health. They're concerned about the rise of fossil fuel infrastructure, and specifically on contributions of the next generation. They're interested in the investments we're making at the state level. So Governor Hogan, we're talking to you. They're concerned about risk of privatization and explicit considerations of human health. They're concerned about lack of voice and agency and the footprint and what it's like to live in the footprint of all of the above if you don't have a place to enter in and say what you care about. They're concerned about loss of community caused by changes in the use of land and related air quality degradation, water usages, and spikes by commercial interests that have access to quality of air and water that communities have to fight for. So I'm going to hand it over to our first partner, Ava, to talk a little bit about Baltimore, specifically air quality and community concerns that come from her work. I'm going to run the slides, Ava, so if you're there, you just let me know and I will move them forward. Let me just make sure that Ava is able to speak to all of us. Ava, are you here? You should be.
I think she might be listed as an attendee and not a panelist. Are you able to upgrade her to be a panelist?
Done. Oh, it says that she is using an older version of Zoom. Let's see what we can do here. Give us just a second, everybody. We're trying something new today. Ava, hi. You're here. Let's see. We can see you, Ava. Can you hear us? Can you see or hear us? Mhm. So 1 second. Ava?
So I can start walking people through the presentation if you want to.
If you wouldn't mind.
This is Ava. Sorry.
Oh, great. Go for it.
Sorry, I didn't have the ID before. Hi everyone. Sorry, Mike, I didn't mean to interrupt you.
No,
Did you
go
want me
ahead.
to just pick up here?
I was offering to
Okay.
step in if you weren't able to be heard, but go for it.
Okay, awesome.
Welcome.
Thank you so much. Yes, thank you so much, Tamara, for that lovely introduction and for inviting us to speak today. Again, my name is Ava Richardson. I'm the program coordinator with Energy Justice Network. I'm heading up our Clean Air Baltimore coalitions here in the city. And so today I'll be talking to everyone about one of our biggest polluters in the city, which is our trash incinerator, Wheelabrator. Am I able to control the slides?
You can just tell me next slide and I will make sure that it happens.
Oh, okay. Thank you, Tamara. Again, Wheelabrator, it is the city's biggest trash incinerator, and it's one of the biggest in the state as well, with the capacity to burn more than 2,000 tons of trash every day. Next slide, please. And so we're going to dive into some of the specifics of exactly what trash incineration is and some of the detrimental environmental as well as public health effects associated with it. Next slide, please. Generally, when we think of ways to mitigate or handle our waste, trash or burning our waste is the most energy intensive and the most expensive way to manage it. Compared to landfilling, it's roughly 40% more expensive based on data from the National Solid Waste Management Association. Next slide, please. And in terms of making energy, it's also not a very efficient process. So a lot of people, one of the really pernicious fallacies associated with trash incineration is that it's waste to energy and it's renewable energy, which is not true at all, because it is such an inefficient process to burn trash. One, we extract those materials from the environment in order to make them, and we don't put them back into the economy. So we lose a lot of money when we do that in terms of not recirculating that material. And again, it's incredibly cost intensive, and we lose out on jobs as well as other benefits to the economy when we resort to burning our trash. Next. I love the blinds effect. When it comes to, when it comes to the pollution associated with trash incineration, we know that this method of managing our waste is actually worse than when we compare it to coal plants. So in terms of some of the nastiest emissions and toxins that are going into the air, including dioxin, lead, nitrogen oxide, and sulfur oxide, trash incineration is worse compared to coal than all of those. Next slide, please. And we'll get more into the nitty gritty of those toxins later on the slide presentation. Compared to landfill, and the environmental effects associated with incineration are far much worse regarding global warming. Again, the toxic emissions, and this is really one of the most challenging environmental racism issues. Trash incinerators are often in Black, Latinx, and low-income communities. And so these communities that are already heavily burdened with the higher prevalence of disease, and we see worse health outcomes, they're even more burdened by this environmental racism issue and all the challenges that come along with that. Next. Again, going back to the fallacy that this is a renewable source of energy, people think that when we burn our trash, we somehow magically eliminate it, which again is not true. So when trash is burned, for every 100 tons that is burned, we get 30 tons of ash. So 30% of that creates a very toxic, densely concentrated, an ash that has a high level of densely concentrated toxins. In the remainder of that, we breathe in. It gets released into our air. And so considering the amount of money, particularly in Baltimore, $2 million a year that we pay to have our trash burned, we're basically paying to poison our residents. And again, so it is an incredibly counterintuitive trash or waste management method that we really need to move away from. Next. And so we see in Baltimore, we see what the health effects are in terms of the increased asthma prevalence, with roughly 25% of children in Baltimore having asthma, and roughly 10% of adults across the city having asthma. According to the Asthma and Allergy Foundation of America, Baltimore, in terms of the asthma capitals of the world, we're number 33. We're the 33rd worst in terms of out of 100 cities. So we know that we have a lot of work to do when it comes to improving our air quality, to ensuring that we are addressing the public health challenges associated with that. Next. In asthma, it has an incredible cost to the city. Again, according to the Asthma and Allergy Foundation, in terms of the years of productivity loss, the public health burden, there was an estimated $156 million in economic costs regarding asthma alone for the city. And that's not including all the other health issues that could be associated with emissions. We see here a young woman who has asthma with her inhaler. Next slide. And my colleague, Dante Swinton, who is the organizer and researcher with our organization, he's also on the line. Dante, please feel free to jump in at any point. And so when it comes to where the trash comes from, a lot of people are very surprised to learn that much of the roughly 40% of the trash that comes to our incinerator is not generated by our residents. We burn about 6% of that comes from Baltimore County. And then we also burn trash from Anne Arundel, Howard, and St. Mary's counties in Maryland, roughly 7 counties in the state, even as far as Pennsylvania. So again, Baltimore is it's basically a dumping ground when it comes to so many jurisdictions and counties sending their trash here to be burned, which then heavily burdens our residents. Next. Next. I'm sorry. Well, I can just speak to that. But our contract for the current for the Baltimore incinerator is set to expire in 2021, and so later, Mike and Dante, they'll talk about the Baltimore Clean Air Act in how we hope to challenge some of the kind of current waste management norms in the city with that. In addition to the Wheelabrator incinerator, we also have Curtis Bay Energy, which is a medical waste incinerator in the city. Next. So since in this facility, it actually burns medical waste from 21 states, even as far as Canada. So again, more burden. And most of these facilities, they're all in South Baltimore. So those communities there, Cherry Hill, Westport, they're being just kind of they're breathing in all these toxins and dealing with all those the negative environmental effects of these facilities. Next slide. Since 1988, roughly 6,000 medical waste incinerators across the country have actually closed. And Curtis Bay Energy is actually one of 30 incinerators remaining in the country. So we know that there are better, smarter ways to manage our waste, whether it's medical waste or whether it's waste that we produce in our homes. We just have to really be smarter and take the initiative as a city to say that we care enough about the environment, and we care enough about the health of our citizens in order to make that change. And as we will see later, it is actually more, it makes more financial sense to do so. Next slide, please. In terms of some of the things, again, that are emitted due to trash incineration, again, we have some really nasty things, including mercury, sulfur dioxide, lead, and nitrogen oxides. And we'll talk about some of the health effects of each of these. Next slide, please.
It seems like such a terrible thing to be number one at. It's such a cheery image until you think about what that kind of categorization means for people's health.
Absolutely. You know, we want Baltimore to be number one for the right reasons. Thank you so much, Tamara, for highlighting that. And being number one in terms of the emissions of these really disastrous toxins is not what we want for our city. Nitrogen oxide, we know that there are myriad health effects or health challenges associated with exposure to this air pollutant, including respiratory illnesses as well as stroke. And many studies associate exposure to nitrogen oxides with increased hospital emergency room visits due to its effect to cause several different health issues. And again, we know that the emissions from trash incineration compared to coal plants is 3 times higher for nitrogen oxides. Next slide, please. And so this graph shows the percentage of nitrogen oxides that are released from Wheelabrator compared to other sources. And so we see here that roughly 13% of the emissions come from Wheelabrator compared to 75% for mobile sources. Next slide, please. And again, when it comes to comparing Wheelabrator to mobile sources, we see 18% in that comparative analysis based on EPA data. Next slide, please.
Could I just ask you to just define what mobile sources are, because not everybody is thinking about this at this level. So I just want to make sure we're helping people think about what it means to have a stationary source of pollution and what the other things are in that mix.
Yes.
Ava, could I step in real quick just for this slide?
Please do.
Okay, yeah. Sure. So for this one, as Tamara mentioned, mobile sources are any wheeled or vehicle or airplane or marine vessel, which is in the blue here. The green in this graph are the typical cars that you see on the roads every day. The gray are the typical trucks and buses that you see on the roads. And so by closing Wheelabrator, it would be the equivalent of taking half the cars or half the trucks off of Baltimore's roads regarding NOx every year, which is a very impactful statement. That yellows specialty cars and what have you. But we cracked open the mobile sources bit just to show how damaging this particular facility is when you talk about mobile emissions, because folks don't realize that that kind of pollution is coming out of the smokestack more often than not. And so we wanted to shed some light on that with these graphs, and I'll pass it back to Ava.
Thank you.
Thank you, Dante.
I mentioned this pulling this out specifically because our very next webinar on the 17th will be about transportation and climate. And I think people fail to recognize how much power we have in this space. And when we're talking about fighting a staid industry, regardless of whether that industry is related to transportation and truck traffic, which can be broken down into buses, or dray trucks can be broken into buses that are going through communities with no consideration of air quality. And as Kathy will talk about later, different industries have different versions of these multifaceted ways that they are continuing to amplify the harm. So I just wanted to stop here for a second and just really talk about like the levels of threat that communities are facing. So thank you both.
Yeah. Yes. Thank you, Tamara and Dante, for contextualizing that. Indeed, and feel free, either of you, to chime in as I move along. Next slide, please. And so, as Dante mentioned, closing the Wheelabrator incinerator would be equivalent to removing half the cars off the road, which would be roughly 123,000 vehicles. Next slide, please. In terms of sulfur dioxide, again, this is another substance known to trigger asthma attacks, as well as known to be associated with heart disease and stroke. And so when it comes to the increased prevalence of both of these diseases in the city, we know that in some way this facility can be contributing to that burden. Next slide, please. Again, when we look at Wheelabrator in terms of its sulfur oxide emissions compared to everything else in the city, we see that roughly half of the sulfur emissions are due specifically to that facility, which is a staggering statistic. Next slide, please. And again, to Tamara and Dante's point regarding the mobile sources, looking at those alone compared to Wheelabrator, the facility comprises more than 50% of the emissions compared to those various mobile sources. And I don't know, Dante, if you had anything to add there.
Yeah. So just real quick, that as you can see at the top there, the 6% is from the typical cars again, and then there's that tiny sliver of gray, which is another percentage point. So Wheelabrator contributes 7 or 8 times as much sulfur dioxide to our atmosphere every year compared to all the mobile sources on the ground in our city, which I think really should say something about this facility. And that particular pollutant. So just wanted to underscore that.
Absolutely. Thank you. Again, dioxin, which is one of the deadliest toxins or substances known to the scientific community. This is created when we burn our trash at places like Wheelabrator and Curtis Bay Energy with medical waste. Next slide, please. There has been determined to be no safe level of exposure to dioxin. It has a bioaccumulative effect. So it is a fat-soluble substance, which basically means that when we eat certain foods that have been, certain animals that have been exposed to dioxin, such as beef, or when we consume dairy, this is accumulating in their fat cells. And so it continues to circulate throughout the environment. And we know that this substance is associated with respiratory and nervous system health challenges, as well as being carcinogenic and teratogenic. So very nasty pollutant and toxin that's being released from incinerators here. And Dante, if you want to chime in on this, let as well, feel free to.
And I'll just add here that I think because we're going to be talking about state level initiatives, we should really point out that air quality doesn't have a zip code. So the pollution that's happening here and that is coming out of the smokestack goes all over the state, where there are farms doing all kinds of agricultural work. And so these threats are exactly as viable to them. In addition to what might be happening locally, there's this state level pall that's connected to regional pollution. That, I mean, I was in a conversation with some folks at MDE just last week about them already charting how much of the smoke from California, the California wildfires, have already made it here. So if all of this is happening in the baseline of where we are every day at the hyper local level, if communities are exposed to threat every single day, what are the chances that a cataclysmic event like what's happening in California will only double down on the poor health outcomes for folks who are on the ground? Dante, you want to expound on that?
Yeah. So when it comes to dioxin, there have been studies of folks in Northwest Canada, First Nations, that had dioxins in their system. And the only place that could have come from was from the East Coast, and just wind patterns managed to bring those pollutants in that direction. So even we have essentially an international impact with these types of pollutants coming out of incinerators and coal plants and what have you. But in terms of dioxin, it's one of the, like Ava said, it's one of those pollutants that really builds up in the system and can be transferred. So if you are an expectant mother, those pollutants will be impacting your fetus. And then within the first 6 months of breastfeeding your child, 20% of the toxins that have been building up in your system will have been transferred to your child through no fault of your own. But these types of pollutants stick around, and so that can lead to issues with IQ, levels of violent behavior, respiratory and nervous system problems, as we mentioned. And so it's one of those things that we just have to pay more attention to, for sure.
And it sounds like
thank you.
A multi-generational threat.
Absolutely. And yeah, thank you Tamara, to your point, I think a lot of times people look at a lot of these facilities and people think like, not in my backyard, but there is no such thing as not in your backyard, because if it's not in your backyard, it's hitting you some way, either your front yard or somehow we're all exposed to the environmental degradation that comes from these as well as other facilities. So again, 93% of the dioxin that we're exposed to in society comes from meat and dairy products. Again, because of that bioaccumulative effect that Dante also spoke to. Next slide, please. So one of the questions that we frequently get is, where will the waste go if we don't burn it? And so I think one of the kind of things that the question fails to realize is that one, when it comes to creating waste, it's a privilege to be able to do so, but two, we really have to create better ways to close the loop on our waste and to minimize our waste. So we'll talk more about that on the next slides. So when it comes to when it comes to in terms of like where our trash goes in the city, most of it does go to the trash incinerator. And then we do have a landfill that is owned by the city government. And so our trash will go there. So we see in 2016, 21% of the trash went to the landfill, but the overwhelming majority of our trash was burned at Wheelabrator. Next slide. When it comes to comparing, again, landfill to incineration, we know landfilling is not environmentally benign because of the leachate and the concerns about groundwater, and just the counterintuitiveness of building mountains of trash. We know that there's nothing about that is good. However, we do understand that when compared to incineration, it is the preferred method when we consider public health and when we consider cost. Obviously, we want to move towards a zero waste society. We want to move towards a more circular economy, but we need the infrastructure in order to do that. So there is also anaerobic digestion, which is a way to create methane gas. And electricity can be generated through that process. So oftentimes, methane is produced from organic materials, including food scraps that sit in landfills, which often can be captured from the landfill, but it's a very inefficient process the way it's captured if the organic material is just sitting there. If we extract that organic material or divert it from the waste stream, in either composting or we can use anaerobic digestion to create energy from it. And it's a much more efficient process and a more environmentally conscious process in terms of creating energy. So next slide, please.
Can I ask, so I'm from New York City, where we have had some experience with anaerobic digestion and issues of justice around siting and community capacity and competency around the building and location of these kinds of things. I just wanted to take the opportunity to talk a little bit about the idea that one of the things that is happening, regardless of where this stuff ends up, is a lack of communication between the folks who are live where these things are cited. And regardless of whether we choose the very best possible version of what happens to all of our trash or our waste or the leavings from industrial practices, if we are not having conversations with people about what this means and what it could potentially do to their health, we are failing to address the health and justice implications. Thoughts?
Yes, thank you. Yes, definitely. And so when it comes to specifically anaerobic digestion, it is a process that requires a huge investment at the beginning, because you want to make sure you have a resilient system, so that one, there's not leakage, in which I think can contribute to just kind of like noxious smells or you know, a public nuisance in terms of the methane getting out into the environment. When it comes to kind of like some of the byproducts that come off, there is a digestate or a liquid that does drain from the system. And so there could be concerns about that getting into groundwater as well. And I agree. I think when it comes to land use policies and what communities get burdened with these facilities, that conversation often is not had with the communities that it ends up in. And so there definitely needs to be a more equitable process in terms of land use policies to ensure that whatever that burden is, it's shared among society. And we know that that has not happened. Generally, it is the communities with the least amount of power that get burdened with these facilities. While I would say that anaerobic digestion or any kind of combustive process, that is not considered like the first method to mitigate our waste or our trash. As we'll see later on the waste hierarchy that we will refer to on a later slide. But we really have to rethink and redesign our system. We really have to think how we remove these things from our waste, these products from our waste stream. In truly anaerobic digestion, it is a last resort. And it's not something that we recommend automatically when it comes to organic waste materials. But I definitely think when we talk about environmental justice, if we're not talking about the land use and the zoning policies that go along with it, we won't get far when it comes to equity and how the land is used and who's burdened with various facilities. But Dante or Mike, if you want to chime in on that, please go ahead. If not, we will move to the next slide.
And we already have some questions. So if we'll just pivot for a second just to answer a question, and any of our guests can answer.
Sure.
Are there technologies, including converting waste to biofuel or pellets, that could also be considered? I can speak a little bit to the conversation around biofuels. In the very early part of my career, I lived in Denver, Colorado, which is closest to one of the few communities where biofuels have taken off, mostly because it involves consistently adjusting the mix for temperature. And it has been Thanksgiving just passed, the tofurkey of all of these sort of policies, because it has so much promise, but because it is not a thing that can be applied uniformly with very little testing and development, it has not gone as far as the promise. But I will leave room for anybody else to weigh in on other options other than these.
Okay, I'll weigh in a little bit. This is Mike. So the problem with the biofuels efforts has been that they're far too expensive, far too experimental. All our small scale experiments just being started, so they're not commercially viable yet. We're not sure they ever will be. They've been trying for 20 years to become commercially viable. And a lot of them still involve incineration of some sort. So it doesn't make sense to compete for the same materials that are compostable or recyclable by trying to pursue biofuel schemes where most of the things in trash aren't even suitable for converting into that in the first place. And this idea of pellets actually is even worse. Turning trash into pellets just means you're going to burn those pellets either in an incinerator or a cement kiln, which has been done a lot in the region. And that is actually worse than conventional incineration because cement kilns are not designed to even have the pollution controls that typical incinerators do. The big controversy around the Energy Answers incinerator that was threatening Baltimore was actually going to do that pelletization. well, they weren't going to do the pelletization, they were going to burn pellets that would be created from trash elsewhere and burn them in Baltimore. So that's definitely a non-starter.
Tamara, this is Kathy. Could I add a comment to this discussion?
Of course, please do.
And I'd like to add to that what I think we really need to see happen sooner rather than later is a much broader and, well, a more focused and louder discussion about reducing our use of various, single-use products in order to reduce the amount of trash that we have to deal with. Plastics is a really big part of that. And there really has to be a concerted consumer effort to force manufacturers to rethink how they package materials so that we can reduce the amount of plastic and especially in many cases, non-recyclable plastic materials that are used as packaging. And of course, everybody's familiar with the over packaging of consumer items, where something is wrapped in plastic and then sealed inside of plastic and then vacuum sealed inside an outer plastic container. So while we have this immediate problem of what do we do with all this trash, we definitely have to have a much broader discussion about how do we just reduce our trash, how much trash we create overall as a society. And then one other point based on some of what we've been hearing, for instance, down here in rural communities where anaerobic digestion and various methods of dealing with excess agricultural byproducts, particularly manure. There's a lot of effort right now going on to create waste to energy power plants down here on the Eastern Shore. And one of the immediate problems that the local communities see with that, even though it's not a pipe smokestack type industry, is the amount of truck traffic, diesel truck traffic that will increase in our rural communities in order to truck in all the various biofuels that are needed to feed these power plants. And these rural communities are very concerned about the increased level of emissions from diesel tractor trailer and other increased commercial vehicle use on our small rural roadways down here, and also impacting especially air quality. Thank you.
Thank you, Kathy. I was waiting. I was trying to goad you a little bit there when we were talking about about dioxin, because it is a thing that compounds some of the stuff you're going to talk to us about a little bit later. So thanks for taking the bait.
I'm not sure if I could speak up now or had to wait for my turn. This all came about. But, all right, I'll jump in more often now.
Yeah, no, feel free to jump in at any time. No, but thank you. Very, very robust conversation. Next slide, please. And again, this is just kind of diving deeper in terms of one of the places where Baltimore sends their waste. Next slide, please. When it comes to the amount of waste that we send to landfills and incinerators, 75% of that can either be recycled, repurposed in some capacity, or composted. So generally, waste streams comprise of 30% organic materials, which is food waste and food scraps. And that's not including all the yard scraps and yard waste that gets produced. And then roughly 40% of that can also be recycled in some form. Next slide, please.
Yeah, and just to clarify, since we did get into a discussion, this set of slides is talking about where our waste would go moving forward. So the primary place would be Quarantine Road, as we currently own that landfill. and it's due to be expanded to extend capacity. And so in the event that we took longer to build the recycling facilities needed to replace Wheelabrator, which I don't think we would take that long to do, we do have a space to put that. So there wouldn't be trash strewn across the streets and everything, and everyone had to swim to stuff to get to work. So I just put that out there.
Yeah. And did you, I mean, Dante, you can speak to this slide as well if you want.
Okay. Yeah, so this is Recycle America, where our recycling currently goes. But our recycling is not very clean. There's a lot of contamination because of food waste, leftovers in some of the plastic containers. The glass, since we don't separate that out, ends up getting crushed, and we end up losing the value there, because if it's separated out, it's actually a lot more valuable for the city. And so we have to pay, which has typically been less than paying per ton for burning at Wheelabrator, but they're missing out on a lot of good value with us sending it over to Elk Ridge and not actually building facilities here in the city to create those jobs and to make money off of the materials, selling them off the market. So we would need to go to the a better zero waste approach by building facilities like this. Next slide.
And I'll just add that all of this presumes that there's a market that will take it, which is a huge determinant of whether even this terrible strategy that we have going on in Baltimore could have any impact. And yes, I said it.
Yeah. I mean, and that's the thing. The national sword policy by China has definitely had a major impact, but it actually could be a real boon to the United States, as every time we send material over to them anyway, we lose out on hundreds of jobs, because those jobs could have been used to be sorting out those plastics, sorting out any glass and anything of that nature, and actually building up a greater economy. So instead of seeing doom and gloom in China's approach to respond to Trump, we can actually see a benefit out of it. Next slide.
Actually, let me jump in with one quick point. Composting is totally immune to the impacts of China and markets, because our compostables are all dealt with locally.
Could you say that again, Mike? You were a little low.
Oh, sorry, I'm trying to speak in my mic. The composting market is totally immune to anything going on with China. So if we got composting going, we can get a lot out of the waste stream, and it's not subject to the market fluctuations that depend on global markets.
Yeah. Just to add to that, composting, not only does it kind of like recapture those materials, so you can use it for either farming or gardening practices, composting holds a lot of water. And so when it comes to mitigating floods in certain areas, it has been determined that roughly like a quarter inch of compost over an area can help stave off some really disastrous flooding events, as we see stronger and stronger storms coming. So it's a way to really promote environmental resilience by just capturing that organic material and putting it back into the environment in some way. All right, next slide.
Oh, actually stay at that slide, please. And so that slide that we just skipped through was talking about the average cost of these recycling facilities. They're usually in the $8 to $15 million range for capital costs, which sounds like a lot, but this is in comparison to the $200 million it cost to build Wheelabrator and the $1 billion it would have cost to build the Energy Answers incinerator down in Curtis Bay. So for small fractions of that kind of a cost, you could build the facilities that would be able to create jobs in different parts of the city, and then proceed to market that material off and make the city even more money. So it's a lot more economically viable to go in this direction than an incinerator. And for example, San Francisco's facility has about $35 million, but it could handle the total amount of material that Baltimore City handles every year, just processing it through their material recovery facility. So just to give that aspect in there. I'll pass it back to Ava.
Oh, thank you, Dante. And so when we talk about, again, that zero waste or circular economy, based on some research that Dante has actually done, it's determined that these jobs for recycling and compost, they can create up to 10 times as many employment opportunities compared to incineration or trash incineration and landfilling. Next slide, please. So when it comes to actually, Dante, I'll let you speak to this, sorry. In terms of like
Yeah,
zero waste jobs.
So when it comes to job creation, as Ava mentioned, it's at least 10 times as many jobs when you decide to compost, recycle, and it's up to 300 jobs per 10,000 tons of material when you use and remanufacture. So if we create a circular economy within Baltimore, we're talking thousands of jobs that can be created simply because we've decided to change our behavior. And these jobs tend to be living wage jobs, whether part-time, permanent, or otherwise. And we would definitely want them to be unionized as well, just to make sure that they do have their say in how they're treated, unlike Wheelabrator, which is not unionized. So if we're going to try to alleviate poverty in the city, moving toward a zero waste economy is a very critical component of that. So as you can see here in this slide, the reuse and remanufacturing, as I mentioned, just skyrockets beyond the recycling sorting. And you can see a little bitty incineration and landfilling up to the top because they don't create jobs. They're just a waste of energy. Anytime they say waste to energy, is just their commercial term. They're not converting anything. They're not a nuclear reactor. But you can see just by deciding to have to deal with those materials instead of burning them and losing their value, we can just put people to work, minimize the 13% unemployment rate of Baltimore City by doing this. And it's much more sensible to go this route than to maintain the status quo and continue polluting the community. And I'll pass back to Ava.
All right, thank you. And so going back to Tamara's point earlier, and to the point that Kathy made, so when it comes to kind of like that zero waste hierarchy in terms of how we extract materials and reuse them and repurpose them, we really do need to rethink and redesign the way that we kind of interact with our waste, or be more conscious of the waste that we produce by getting rid of single-use products altogether. And then obviously we have to reduce some of their consumption. So I carry around like a little tiffin, which is a metal lunchbox, and often we'll use that when going out to different places. So I don't have to use that paper or that plastic plate. Again, we have to increase our recycling and composting rate. In terms of what we recycle and compost in the city, I believe recycling is 17%. Dante, correct me if that's not right. And composting is really dismal, at around 2 or 3%. So we're not getting nearly the value back out of these materials that we've extracted and putting them back into use somehow. And again, when it comes to the biological treatment, or when it comes to kind of like the biofuels conversation that we had a little bit earlier, that is really an unacceptable way to manage our trash, as we saw, because of the negative health effects, because of the counterintuitive economic effects, how expensive the process is. So we really push this model, push this hierarchy in terms of how we redesign our system so that we're some folks may say that it's not that we have a waste problem, we have a design problem. And so when we design that infrastructure and talk about the recycling, or establish the recycling facilities or the composting facilities that Dante mentioned, then we really created a smarter system that reduces waste. But until we do that, it's really going to be hard to move the conversation forward. So this is a really useful model to help us think through that. Do you want to chime in here at all, Dante?
Yeah. So the residential recycling rate's not, barely, not even 15%. And when you think about that, we mentioned earlier, that 75% of what we throw out is compostable or recyclable. So we're missing out on 61 points of material that could have been used not only to create money for the city, but to create a lot of jobs. So that's something that I really want people to take away. And on top of that, to Kathy's point, we only really recover about 2% of the plastics that we throw out in the city. No municipal waste, so that's 0%. No municipal food waste, so that's 0%. But think about that. There's so much plastic out there, even if there are over 1,000 kinds, and yet we're only recovering 2% of it, and which means we're missing out on a lot of value there, missing out on a lot of value on glass, a lot of value on metal, and this is because we're in a single stream system right now. So we also eventually will need to move back to a multi-stream to get the most value out of it. But the point of that being, there's so much that we're losing simply because we haven't engaged communities with aggressive education to discuss the fact that it's really beneficial for them in terms of their health and in terms of economic justice to go in this direction.
And I'll before we move on from this section, I'll just share a joke that I found on Twitter that Greenpeace has been circulating in the last day. Ladies, if he doesn't refuse, if he doesn't reuse, if he doesn't recycle, he's not your man. He's trash.
I like that. Those are words to live by.
Which I thought should at least deserve some sort of honorable mention in this conversation.
Thank you, Tamara. I love that. So what are the next steps? And so actually, Dante created the Divert Baltimore program, and I'm going to go ahead and pass things off to him to talk about it.
Okay. Yeah, so we started realizing that folks would need to have an ability to make that connection between Will Grader and their trash bins because Maryland law mandates that incinerators can't release visible pollution. And so it's very out of sight, out of mind, despite the fact that everyone knows that smokestack. So what we wanted to do is bridge that gap of knowledge and put together an on-the-ground vision of a zero waste economy. And so what we did is, next slide. So we ran the first program at the end of October of last year into January of this year. And see a cute little recycling kit. Next slide. And so what we did is that we went around Westport, Mount Winans, and Lakeland, the host community area of the incinerator, at about 100 homes to participate in the 3-month pilot. Within the 2 months that we were recycling, the first month was just baseline trash data. They managed to recycle, that's supposed to be 4 tons in 2 months. So pardon that typo there. But we increased the overall amount of material that these homes were producing by about 82% over the city average. So I went in and tried to do some calculations. Per household per week, we throw out about 6 pounds. The folks in the community overall recycle about 11 pounds a week, which was awesome. But those who came to the workshop to learn the type of stuff that we've been talking about today, they recycled 157% more per household per week, or over 14 pounds. So clearly education has an impact, as well as providing access to these bins for free, since the city still charges for its recycling bins. And we find that to be a major concern, of prohibitive costs for people to get involved in recycling. And so we gave those bins out for free. Had people, 5 block captains hired to do that data collection for us, and paid them $2,500 across the 3 months. And yeah, and then we managed to give $400 to $1,200 for the top 5 winners in the program, which was really exciting to help those families out in a community with a 33% family poverty rate. Next slide.
And I just want to chime in here, Dante. I think this really challenges the notion or the idea that, you know, certain communities don't recycle or certain communities don't care about the environment. And I think really what happens is certain communities aren't engaged on this issue, which Dante really highlights here. When that vigorous effort is done, we do see that change, but there has to be investment in those communities. You can't just assume that people don't want to or they're not willing to. So I think with this program, we can really see some systemic change across the city. But again, it requires that investment, and it requires people who care enough to do enough to implement programs like this. So,
absolutely. And so with that being said, we have just started our second incentivized recycling program in Cherry Hill for Divert Baltimore, which is really exciting. We just got funding for a third in Morrill Park and Violetville, which actually has the highest rate of deaths by chronic respiratory disease in the city. And so we find it really important to get folks in those communities involved as well. But the ultimate goal is to take this program from a personal incentive, as we're doing in the pilots, to a community incentive by 2021. We're hoping that within the city's fiscal 20 budget that they work on next year, we actually can get them to participate in this program and take the lead. But we want to set a system up where a community is given a target rate to recycle, so say 30%. And if they hit 50%, then there's that 20% surplus of money that's not being used to burn their trash anymore, and now can be reinvested into the community in whatever way they see fit. So if that's community gardens, if that's fixing potholes, if that's solar street lights, whatever the community needs, that money is now being used to benefit as opposed to being a detriment to that community. And to underscore this, we spend we budget about $10.5 million every year to burn trash at Wheelabrator. So think about that. That's $10.5 million just to burn stuff, when that could have been utilized to build one of those material recovery facilities I mentioned earlier, or even just start fixing issues within communities, opening recreation centers again, all sorts of stuff. But we're just using it to burn trash. So this program would shift that narrative and build up a better community, simply because they're now engaging in zero waste movement, and in the zero waste movement like we have been pushing for. And so we're really excited about it. We think we've got a good shot at it actually happening. And so we're going to go from there. Next slide. And I think that's Ava again. Yeah. Mm-hmm.
Yeah. So here we're going to pivot to Kathy, so she can talk to us a little bit about the state conversation that we're having around what we're doing in the waste space, what we are doing with people's health, and how we are making decisions around what's impacting the air quality of our communities and ultimately creating some poor outcomes. Kathy, I'm going to pull up a slide about the Community Healthy Air Act, and then let you talk to our audience of environmentalists, health practitioners, and human beings who don't want to be injured by the state. Thank you so much. And we'll come back to energy justice.
There we are. Sorry, I was on mute. So anyway, thank you everybody for, and thank you Tamara for having me on the panel today. It was a little short notice. I don't have a real fancy PowerPoint for everyone, but thank you for at least pulling together this information about the Community Healthy Air Act. So for those who may not know me, I'm Kathy Phillips. I am the Executive Director of Assateague Coastal Trust down here on the lower eastern shore of Delmarva. I am also the Waterkeeper down here for the Coastal Bays watershed. So I have the title Assateague Coastkeeper. I'm a member of Waterkeepers Chesapeake and Waterkeeper Alliance. We have an issue going on down here related to water quality, but it actually is a much broader concern, and it has to do with air quality on the lower shore. a number of community members came to me and to Michelle Merkel from Food and Water Watch and to a couple of other groups about I guess we're going on 4 to 5 years now of we want to find out what is in our air down here, and we want to determine why is it that 1 in 4 Wicomico County middle schoolers have asthma. And we want to find out why it is that our emergency room admissions down here have very high rates of admission for pulmonary distress issues with patients. Our air quality down here, especially in the summertime, is not good. But unfortunately, and how do we know that? Well, we basically just know it from our own experiences of what we are personally experiencing with burning eyes, itchy throats, and coughs, and then having problems with colds and bronchitis and that sort of thing. We don't have any air quality monitors here on the lower shore. The closest air quality monitor that we have, one is located in the Blackwater Wildlife Refuge, which is a good 70 some miles away from, let's just use Salisbury, Maryland as the center of this area of concern. There is also an air quality monitor in Delaware, located near Seaford, Delaware. So that is close to the Maryland border, and again, maybe about 40 miles from Salisbury. But the data from that monitor, when you go to look at the website and track the data, it only lets you know about the air quality in Delaware, and then you have this straight line at the Delaware-Maryland border, and we're suddenly, while just above that and at that border in Delaware, air quality is colored in red. A citizen looking at that sees that immediately on the south side of the Delaware-Maryland border, air quality is green. And so we need air quality monitoring on the lower shore, and especially in the Wicomico County, Somerset County area, and even parts of Worcester County, Maryland. So what evolved out of this concern was to begin looking at reams and reams of documentation about air quality in other rural areas throughout the country, and where it has been monitored, what are the pollutants and where are they coming from? And we kept coming up with this connection between industrial animal farming and sorry, I won't even call it farming, just industrial animal production and poor air quality. So the Community Healthy Air Act came about 2 years ago. This will be our 3rd year introducing it to the Maryland General Assembly. And the Community Healthy Air Act is nothing more than a request by these communities here on the lower shore to have air emissions from poultry confined animal feeding operations monitored by the Maryland Department of the Environment, and then to have that data collected and reviewed and peer reviewed by a panel of public health and scientific officials. And this is not actually regulation. It's a pretty simple, straightforward bill, but we really do need more voices to help amplify the voices of these citizens down here, where we live on the lower shore, where a number of the people that have been community leaders in this process to get the Community Healthy Air Act bill through the General Assembly, they themselves have asthma, or all of their children have asthma, or in the case of Mary Ashanti from the Wicomico County NAACP chapter, you know, many members or family or members of their families suffer from either asthma or respiratory distress in one way or another. So it really has just come down to people want to know what's in the air that they're breathing down here. And the best way to find out is to do a local study. And some of you may ask, well, if you already have all this research and data that's been done throughout the US, why isn't that then showing cause, and why isn't the state of Maryland saying, you're right, we should do something about monitoring and filtering and controlling the emissions from these large industrial poultry houses. And what our problem has been is that our politicians, and unfortunately even our some of our public health departments down here, or officials within the public health departments, have said, well, none of that data is appropriate or pertains to our problem down here because it was all gathered elsewhere. Which of course we all know, ammonia is ammonia, and problems from ammonia doesn't matter whether you're in Arkansas or Wicomico County, Maryland, it's all the same. But this is why we decided, okay, we need to get the Community Healthy Air Act passed. We need to have Maryland monitor its own air and support its own communities and help these citizens down here find out what is in the air they're breathing, and then what are the next steps that need to be taken to assure healthy families down here in this community. And bear with me, Tamara, I'm looking at a couple of things that you had said earlier, I guess where you were trying to encourage me to speak up. So one of our biggest problems down here, and one of our, I'm not going to say problems, one of our biggest needs is that the voices of the community members down here, they have been fantastic. They have helped to elevate each other's voices. They have given incredible testimony during bill hearings in Senate and House environmental committees, but they need a louder voice, and we need more participation from the public health community, from the medical community, to help get this bill through the committees. We are in a dire situation down here. We have families that have had these giant confined animal feeding operations move in right next to them with all of the unfiltered exhaust fans from the poultry houses pointing right towards their property. In some cases, they might be, these fans might be as close as 200 feet by zoning regulation to the neighboring houses. And they realize that they can no longer, that they have lost value on their property. They probably can't even sell their property if they wanted to. And so if they're going to have to remain in this situation, then they would like the state to step up and help protect them. And I think those were the two other points that I wanted to make. Tamara, jump in if you think there's something that I've missed.
So I just wanted to thank you for mentioning what's happening. This isn't, what you're talking about isn't just happening at the level of policy, and it isn't failing to happen at the level of regulations. It's happening in communities. And that's part of why we wanted to feature both of these conversations about what's happening, because the thing that connects a conversation around incineration and chicken houses is that what we're talking about are communities who are being harmed by air quality impacts. We have a lot more information about what's happening in Baltimore, due in large part to the folks on this call who have been digging in deep about the harm. So the not having the hammer of information creates this gray space where communities continue to experience poor health outcomes and to not be spoken to. This isn't just happening in Baltimore. It isn't just happening in Wacomico or Somerset. There are landfill issues that were spoken to a little earlier, fly ash, coal ash, truck traffic. When we look at it all as a piece, all we see are communities where people are not allowed to have the longevity that they deserve for the lives that they have designed for themselves, and are suffering from consequences while we bang our hands, wring our hands asking for information on data. What we do know to be true is that people are being harmed. So I'm going to pivot back to some other action that's happening in Baltimore City, because this proposal for a Community Healthy Air Act is a viable way to start to drill down on what's happening in communities on the ground in the rural and urban space. And our rural brothers and sisters have every right to know what is happening to them. And they've done the yeoman's work to prove the harm, to reach out to the folks who are mandated to respond to them, and to date have received no backup whatsoever in the form of legislation that would support the right to answer, just the right to know. So I thank you, Kathy, for taking the time. I'm gonna briefly pivot to Mike Ewall, who is joining us to talk about what Baltimore City has been doing at the hyper-local level to deal with some of these same issues around communities having the right to know and to defend themselves, and what they have been doing. Mike?
Great, thank you, Tamara. Can I be heard all right? Is it loud enough?
Perfectly.
Great. So, hi everyone, my name is Mike Ewall with Energy Justice Network. I've been working at this, I first fought Wellbrader when I was in high school in 1990, so that shows my age a bit. But and that was in a different wheelbrader plant in Pennsylvania. But since we've been working in Baltimore, we've been working to get a law that I wrote called the Baltimore Clean Air Act passed. And I just want to walk you through that quickly so you understand what it is and how you can get involved. So first, let me just start with a little bit of the need for why this is necessary. So any facility with a smokestack, you tend to hear a lot of the same rhetoric across the country. And I'll hear from folks I've never talked to before, and I'll say, did they tell you this? And they'll say, yes, that's exactly what they're telling us. So it goes a little like this. They'll tell you, and if you I toured the Wheelbrader incinerator, I've toured other incinerators, you see the same thing. They say, don't worry, we have continuous emissions monitors, and we know what's coming out of our smokestack at all times. And if you've been in their control room on a tour, it looks like a NASA setup where you have all these monitors and graphs, and it really looks like they know what they're talking about. And they'll argue that since the state has this data, that we can trust that somehow the state having that data means that they're going to aggressively enforce this. And so wheelbraders or other incinerators are going to stay within their limits, and that the limits mean it's healthy and safe. And that if they go over any limit, they'll be fined heavily, so of course they won't do that. Well, every part of that story is misleading at best. First of all, the limits do not equate to health and safety. The limits are technology-based standards that also factor in things like economics. So right now, when this very incinerator, Wheelbrader in Baltimore, is being required by the state to slightly reduce its nitrogen oxide emissions, the pollutant that triggers asthma attacks, the criteria for this federal rule that's causing this reduction to take place for this one pollutant factors in what it costs the company. So it's not the most protective technology by any means. It's not what's needed for public health. It's based on what the company can afford to economically do. That's a key criteria in the regulations. The other part of this that isn't really true is that companies are not being fined very heavily. It's the cost of doing business. So when they go over a limit, for the things that they're continuously monitoring, they turn in that data to the state usually every 3 months, and they'll give a check and say, here's the check for how many times we violated that standard. And then the next quarter, they'll give another check, and it goes to the state. It doesn't reduce pollution. It doesn't help the community. It just funds the state air pollution regulation program, but doesn't alter the corporate behavior. But the biggest part where the emperor wears no clothes with this is this idea that they're continuously monitoring and knowing what's coming out of their smokestack. because they only tend to continuously monitor about 3 pollutants at most things that have smokestacks. Sometimes you're lucky you get a 4th pollutant, but for the most part, these are not any of the toxic chemicals. These are things like nitrogen oxides that are bad for people's health, that trigger asthma. Also, sulfur dioxide and carbon monoxide tend to be continuously monitored. The other pollutants are monitored once a year or not at all. So go ahead to the next slide. Actually, we'll come back to the point on the slide after this, but just, okay, this is fine. So you'll see there are 3 pollutants that they continuously monitor, including a few other things like opacity, oxygen, and temperature that are not actually pollutants, they're just parameters, like how dark the pollution is or the temperature. And they use that to pretend that they know that they're combusting well and keeping other pollutants low, but they don't really know for sure. So the reason I had on the previous slide, go back to the last slide for a second tomorrow. So my analogy I've been making is that if we regulated speeding on the roads the same way we regulate smokestacks for most pollutants, we would let drivers drive around all year with no speedometer, and there will be a speed trap set 1 day a year on the highways, and there will be warning signs saying, watch out, slow down, speed trap ahead. And then the brother of the driver will be running the speed trap because the companies do their own testing. So that's what's actually going on. And Wheelbrader did actually fail their mercury once a year test, which I call a best behavior test because they're doing it themselves and no one's coming up. It's like an open book test. They failed it in 2009 and got fined, but we have no idea how many other days a year they're speeding because no one's looking, and the company themselves has no idea because no one's doing testing. So you go ahead, back to the next slide. So there are at least 50 different pollutants for which continuous monitoring technology exists, but is not being required by state or federal environmental agencies. So what we're doing is we're trying to get the city to use its power to set a stricter standard than the state and federal minimums. And federal law, as well as Maryland state law, both grant Baltimore and all local governments in the state of Maryland the legal ability to have stricter air pollution laws than the state and federal minimums. Not all states are lucky to have that, but Maryland is one of the lucky states that can. So rather than ask the state to do something stricter, which Baltimore City has asked the state to be stricter on nitrogen oxides from the trash incinerator, and instead of agreeing with the city and setting a limit of 45 parts per million, which is what a new incinerator would have to do for nitrogen oxides, the state set a limit 3 times higher than that. So the city is now poised to move forward our legislation that would actually make 45 parts per million the law of the land. Go ahead to the next slide, please. Okay. So what the Baltimore Clean Air Act does, okay, there are 3 pieces of what it does. First of all, it applies to only 2 facilities in the city. That would be Wheelbrader and the Curtis Bay Energy Medical Waste Incinerator. And any other facility that tries to locate in the city, like Energy Answers did, that would burn 25 or more tons of waste a day would also be subject to this. We don't have any reason to believe a company would be crazy to come into the city after Energy Answers and try that again. So we're only talking about 2 facilities. And there are 3 things that the ordinance would do. First, it would require that they continuously monitor about 20 different pollutants. Second, it would require that the data from that emissions testing be put on a public website real time for the world to see, which Montgomery County already has, and a couple other incinerators in North America are also now doing. And the third step is that for 4 different pollutants, it requires the strictest emission standards that are available anywhere being met by an incinerator in North America to be phased in. And this is for mercury, for nitrogen oxides, sulfur dioxide, and dioxins. And the most expensive of these would be for nitrogen oxides. By the end of 2021, the same day that their waste contracts with Baltimore City and Baltimore County run out, they will be required to meet that 45 part per million requirement for nitrogen oxides. And we know from Wheelbrader's own mouth that they expect it to cost them about $70 million plus $11 million a year just to install the equipment to do that one pollutant and be as clean as a new incinerator would be, or as less dirty, I should say. So we believe that this ordinance will be able to pass. It was introduced with 13 out of 15 council people sponsoring it about 2 weeks ago. It's going to go to Councilman Reisinger's Land Use and Transportation Committee for a hearing in January. And Reisinger is the council member who represents the district where both incinerators are. So that increases the chances that other council people will vote for it because they'll defer to him, which we've already heard. It's a councilmatic courtesy kind of dynamic. And he wants his political legacy to be closing down both of these incinerators, which is really great to see that kind of bold statement. We also have the support of now the mayor's office, the health department, the law department saying it's legally viable, and basically are only going to expect resistance from the Department of Public Works and of course the companies that are directly affected. So we think that we have a good chance of this passing. There will be a hearing, like I said, probably mid to late January. It'll be, I believe, on a Wednesday at 1 p.m. We don't have a date yet for it, but as soon as we do, we'll be asking our colleagues, including anyone here who's interested, to come and turn people out for that hearing, to testify, and leading up to that, if written testimonies can be submitted, we'll be looking for help with that as well, starting this next month. So people can find more information on our website about this. You can go to cleanairbmore.org/Clean Air Act, all lowercase, all run together, or just go to cleanairbmore.org and there's a link to it there. And there are forms where you can sign on and support. And once we have your contact information, we can let you know about meetings, about opportunities to comment, and how to get involved in the hearing in January. And hopefully after that, it'll just be a matter of poking city council members and saying, yes, please finally pass this. And by February, we probably will see this passed into law. Any questions?
So I will, because we're short on time, I'll just read out one or two of the questions. But again, I wanted to just let our audience know, and the folks who will watch this webinar in perpetuity, that part of why we wanted to bring together these two really salient examples of what air can do to communities and what appropriate support from state and local agencies tasked to do their work. There's a whole lot that can be done and that needs to be done in our state to get us to a place where we are not continually forcing communities to have to advocate for their own health without the support of state actors who are in a position to be able to underline, underscore, and communicate that harm and are a duty and should be duty bound to protect it. Kathy, it looks like you want to, do you have anything you want to add here?
Oh, no, I was just listening to what you were saying to see if anything needs to be added, but no, I think you're summarizing it very well. Thank you.
Sure. We did get a question in from Joan Plisco about whether or not there was a Baltimore City composting and strategy plan. So if anybody in the call is aware of that, it'd be great to just let one of our listeners know that that's either coming or that they could participate in trying to develop it.
Yeah, so, and then maybe Ava can put something to this as well. But the city got a grant from the Rockefeller Foundation and the National Resources Defense Council this summer to begin a 2-year study of the feasibility of composting here in Baltimore at a, I guess, municipal level, maybe even regional type of thing, quadrants or so. And so that's good. But the way that the city's structuring it at a press conference to announce the fact that they got the grant was that they're looking at this as like a 20-year thing. So maybe in 2038, composting in Baltimore. But we think that's obviously super problematic. It doesn't have to be that long for us to get to that point. And so we need to push harder to get city government to realize this can happen a lot sooner. If you do that aggressive education, as we've talked about in this meeting, and just constant community engagement and expressing those benefits. So we don't need 20 years to reach that point for us. We need far less than that to get things going. So it is coming down the pipe. I don't know if they've hired that person yet. Ava, you may have knowledge on that. But it is supposed to be a 2-year study moving forward.
Thank you. Kathy?
Yes, to everyone who's on the webinar today, as we get ready to introduce or reintroduce the Community Healthy Air Act for the 2019 legislative session, as I said before, a major component of this bill is that once the Maryland Department of the Environment has collected the data, then there will be a panel that will review the data, write a report, and also have that report peer reviewed. If there's anybody listening to this webinar who might be interested in being part of that panel, anyone from the public health community, or if you have any physicians, nurses, etc., who would be interested in knowing more about this and perhaps being a member of the panel, they can contact me directly. And don't know if you have my email to throw up there, but it's coastkeeper, all one word, at actforbays.org. That's actforbays.org. So it's coastkeeper at actforbays.org. Or you can call me at 443-235-2014.
Thanks so much to Kathy, Mike, Ava, and Dante for taking time to give us a glimpse into what is going to be coming down the pike. In previous conversations, we have talked about a need for stronger, broader, more thoughtful and strategic planning to think about how communities are being forced to bear the burden of air quality threats in their own backyard. So this is just a glimpse into just a couple of places where we can work together, where we can learn from one another to build in strong protections at the local, state, and state level in the absence of federal protections that could or would do this. This webinar will be stored along with the others on our YouTube site, and you can find it on the Environmental Justice Legislative Team webpage. But let's thank each of our speakers today for joining us. The next briefing will be on transportation, climate, and community health on December 17th at noon, and it will feature the Sierra Club. So if you have any questions between now and then, as usual, we will post the notes, this presentation, and the webinar, along with contact information for each of our speakers, because they have active places where you can put your knowledge and insight and plug into advocacy campaigns that are currently being launched. Thank you so much, everybody. Have a great afternoon.
Thank you, Tamara.
Thank you.
Thank you, Kathy.
Thank you, Tamara. Nice meeting you on screen, Dante.
Yeah,
and
absolutely.
Ava, great to hear from you, and Mike, too, if you're still on the line. We can do this.
Thank you, everyone. Very nice meeting everyone virtually. All right.
Bye-bye.
Indeed.
Bye now.
All right. Bye, everyone.